Hi, my name is Dr. Ebtesam Islam. I'm a pulmonary critical care physician at Texas Tech University Health Science Center. I've been taking care of COVID patients in the intensive care unit at Texas Tech University Health Science Center and University Medical Center for the past 20 months. As pulmonary critical care physicians taking care of COVID patients, we have to gown up for every patient that we see. And so our uniform that we usually wear consists of a full zip-up suit, kind of like a painting suit. I have my goggles, my mask, N95 mask, my cap, my shield, and then I double glove with 2 pairs of gloves. And this is what I wear, my uniform that I wear while I'm seeing the COVID patients in the intensive care unit. The ones that are able to talk, it is a very short kind of conversation, and it's more of them kind of gasping for breath while they're talking. You can actually physically watch them talking to you and watch their oxygen drop down as they are speaking to you. And so we just kind of limit the conversation. A lot of them are asking, how are they doing? When can they go home? Are they gonna make it? Will they need the tube down the throat? So these conversations are very difficult to have when somebody's very short of breath. But these conversations are important to have just in case they go on to that next step of needing the life support. It is very difficult to talk to families who are not allowed into the COVID rooms. They do come and visit from the doorway through the windows. There's a lot of conversation that I'm having with these family members. If the patient's awake and able to talk from their phones, we'll dial from their phones, and I'll show them what the room looks like and what the patient looks like so they can see what the situation is. With all the tubing and the machines and the pumps, I try to help them visualize and see as much of the room and the situation as much as possible. As a physician, you encounter a lot of death and a lot of sorrow and a lot of sadness, but I think COVID has taken it to a whole nother level where as a human being, we have witnessed so much death and sorrow in these unfortunate times. I think sometimes everyone expects physicians to be kind of emotionless, and this job is not emotionless at all. And I think that's what creates our humanity as physicians, is that we grieve with the families, we hurt with the families. I firmly believe that. I'm just as human as the next person, and there's no reason to suppress down my emotions. If I have sadness, it's okay. That's part of my grieving process for these patients and for these families. And I think the hardest part is that, you don't just grieve one family that passed away, you're grieving multiple families and multiple patients that have passed away. So when I was, it was just me and my now 12-year-old, she was 10 at the time. For some reason, she was still awake, and I was just kind of hanging out with her, and nobody else was in the living room. And she had so intuitively said to me, she's like, "Mama, are you going to die?" And I was like, I don't know. I was like, I'm trying not to, I'm trying to protect myself, obviously, and, protect others and protect you guys. But it was very hard to answer that question to a child, and the fact that she was able to have the intuition to ask that question really caught me off guard. And so definitely that was a question in my mind, but I didn't know that the children would actually be able to kind of feel that situation. As the winter months are coming in and the cold season, flu season, and still COVID season are here, please continue to wear your mask to protect me so I can continue fighting for your families in the medical ICU.